Heroin use and other harder drugs are on the rise in the East. Dozens gathered tonight in Greenville with one main goal, and that's to save lives. WNCT's Josh Birch was there as representatives from state and local groups gathered to discuss a growing problem. And Josh, how do they plan to combat these drugs?
Well, Ange, it really comes down to having medicine to save lives in the case of an overdose readily available and getting help to those who need it. With a few steps, people I spoke with say deaths and other diseases stemming from drugs could be significantly reduced.
I think it's very prominent. We have a lot of it.
Drugs and alcohol are becoming all too common realities for teens across the East. For D.H. Conley senior Sarah Sudicum, exposure to drugs like marijuana started early.
Somebody brought it to a birthday party and I saw it, and that was probably 7th grade.
But from there, alcohol use and harder drugs like cocaine only become more prevalent.
What we're going to do is if somebody's going to use drugs, let's make it as safe as possible.
Just one drug becoming more common in the state, heroin, which has seen a 402% increase in deaths from overdose between 2010 and 2014. Robert Childs is with the North Carolina Harm Reduction Coalition.
We're seeing a lot more young people who are going on heroin, and when they do that, a lot of them don't know what they're doing.
One way to combat that is to use drugs that reverse the effects of an overdose, like naloxone, which is similar to the drug used to save the lives of at least 4 overdose victims last year in Greenville. And using naloxone is pretty easy. All you have to do is pop off the top, fill this syringe, and then insert it into the leg of the person who overdosed, and within minutes, they'll be revived. Another issue, syringes being shared between users, which has led to a 700% increase in hepatitis C cases over the last 10 years in the state. By starting a syringe exchange program, syringes would not only be more readily available to users, but also increase the users' exposures to possible treatments.
So we can start addressing mental health, we can start addressing some of the other barriers that have been out there for them.
And drugs don't just impact the users. Reuses of syringes can actually lead to things like HIV and hepatitis C. Child says it costs between $385,000 and $620,000 to treat each case of HIV and between $100,000 and $500,000 to treat hepatitis C. Josh Birch, 9 on your side.